An unprecedented case of rabies just happened in Chicago a few days ago. A dog that was staying in a boarding facility was diagnosed with rabies. Now, rabies is not unprecedented. We actually do see cases all over the world, including in the United States. But this dog was vaccinated. This dog was up to date on the vaccines that were required before you can even send your dog to a boarding facility or a daycare. So what exactly happened? Can we even trust the vaccines? Let me explain it. I'm Dr. Orion, a veterinarian and a veterinary behavior specialist. Let's start with the fact that right now it doesn't matter if it's effective or not effective or how effective the vaccine is for rabies. Is required by law in most countries, definitely in all the states of the United States. The dog needs to be vaccinated usually around 12 to 16 weeks of age and then have a booster a year later, and from that point on, usually every 3 years. And that should give the dog enough immunity against rabies, meaning that the titer, that the levels of antibodies against rabies in the dog's system are always high enough that in case the dog is bitten by another rabid animal, he will be mostly protected. In most cases, when we have a dog that was bitten by another dog or by any other animal and we're not even sure if that other dog or if the animal was showing signs of rabies or was up to date on vaccines, if we're talking about another dog, then in most cases we will even booster the rabies vaccine. And in most cases, that's all you need to do. By the way, the same goes for people. If you never had any vaccines before and an animal bit you, even if it's a dog and you don't know if that dog was vaccinated or you don't have access to that dog, for example, you don't know if this dog can be quarantined for observation, and then according to what's going to happen next, they'll decide if you need the vaccines or not, then you are going to get vaccinated. Now, don't worry, it's not like it used to be. You don't need to get any injections in your stomach or anything like that. You get a few vaccines in your shoulder, and that's it. And don't play with it, because worst case, the dog or the animal wasn't rabid and you were vaccinated, probably nothing is going to happen. Maybe in most cases, some slight side effects like some pain on the injection site or something like that. But if it's the other way around, if you were not vaccinated and that animal ended up having rabies and you started showing clinical signs, you're a goner. There's no coming back from rabies once the clinical signs are starting. And it's 100% lethal. So what happened here? How come a dog that was vaccinated ended up having rabies? And how do we even detect rabies? Can we do it before the animal dies? So I'll start with this question. The answer is no, we might not be able to detect the actual causes for the behavior changes in the rabid dog or another rabid animal when it's still alive. Sadly, in order to know, you have to send the head to a specific lab that can detect the virus in the brain. There are no blood tests or something easy for us right now, so the confirmation is always by sending the head. And I know, it's pretty morbid. Now, while the rabies vaccine is very effective, and in most cases it will prevent any chances of getting the rabies virus or the rabies disease itself, nothing is 100%. No vaccine, even if it's something that's very old and very tested even in real life, like the rabies vaccine, no vaccine gives you 100% protection. 99%? Yes. 99.5%? Yes, but not 100%. And that's because sometimes your body or the animal's body is weak because of other reasons. Maybe there's another disease going on. Maybe the dog has some sort of cancer that's actually preventing the body from producing antibodies. Something like what might happen to people that are on chemotherapy or people that are immunodeprived due to HIV. And we might not actually see any clinical signs before it's too late. Another reason is that sometimes the dog maybe was vaccinated, but maybe the vaccine wasn't given in the right way, meaning that it wasn't injected under the skin like it should be. This sadly might happen by human error. For example, if the dog has very long hair, or if the dog is very active and jumping all around, and maybe the needle goes through one side and out the other side, and not all of the vaccine goes into that subcutaneous layer. Or maybe the vaccine itself wasn't kept in the right conditions, or the specific batch of the vaccine was bad and nobody knew about it. There are different reasons that can cause the vaccine not to be effective enough. And then the dog can get rabies. But in order for the dog to get rabies, and it doesn't matter if the dog was vaccinated or not vaccinated, something bit that dog. Another rabid animal bit that dog before that happened. Not right away, by the way. It can take a lot of time between the actual bite incidents and until the dog starts showing clinical signs. Sadly, I don't have all the information, so I'm not really sure what happened here. For example, I don't know if maybe the owners didn't even know that the dog was bitten by a rabid animal, and maybe that happened while the dog was not under full supervision. So, for example, a lot of people will let their dog run outside in the backyard without supervision, and maybe some wild animal that was rabid bit that dog, and it was a very small bite, because just so you know, you don't always need a wolf or another dog to bite you in order to give you rabies. Even a bite from a small bat might be enough. And because it was a small animal, maybe the owners didn't even notice that the dog had a bite injury somewhere underneath all of that fur. And because of that, the dog didn't get a booster for that rabies vaccine, because there's a good chance that if they also gave him the booster after the bite, then it would have reduced the chances of actually developing rabies by a lot. Unless the dog had a crappy immune system, which, again, I don't really know what happened right here. How can you tell if your dog might be having signs of rabies? A lot of people, when they imagine how rabies looks like when it attacks, they imagine that dog that's afraid of water, that's foaming at the mouth, that's behaving like crazy and biting everyone. But that's not always the case. This dog, for example, at the beginning only bit one person. They can actually have all kinds of behavioral changes, but usually those behavior changes happen pretty fast. And the dog might actually become much more depressed and less active, and not just the opposite, not foaming at the mouth and going crazy. So basically, any behavioral change that's acute, that happened really fast without any other reasons, you need to keep in mind that rabies is on the list of things that might be causing it. But again, it sometimes might be hard to say for sure, because the dog might be vaccinated for rabies and not showing classical signs of rabies, and you might not know, like in this case. But again, this is very, 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 very rare. So please vaccinate your dog and make sure that if they have any sort of sudden behavior changes, let your veterinarian know. If you have more questions, please feel free to write it down in the comments. I will try to respond to all of them. And in the meantime, if you can also click like and subscribe to the channel, it will help me a lot, because it makes the YouTube algorithm more likely to make my channel appear on other people that search for the same content as you are. And by the way, when I get to 5,000 subscribers, I'm going to do a raffle of 2 hats, which I'm going to send to whoever wins it. And it's going to be a random thing. You just need to be subscribed and to leave a comment. If you like this video, also watch this video next.